Welcome, everyone. It's the top of the hour, so we'll get started. I'm Dia Waguespack in Houston, and I'd like to welcome you to today's GlomCon seminar. Today, our talk is titled The Evolution of the Renal Biopsy Evaluation. And today, we are excited to have our speaker, Dr. Nidia Messias.
Good morning, everyone. Can you hear me?
Yes.
Okay, sounds great. I'm going to start to share my screen here. And there's going to be screen 1. Let's move this here.
Yes, looks great.
Okay. Hey, good morning, everyone. Thank you for having me here. It's really a pleasure to be with you at GlomCon. Fascinating work, and I love working with you guys. Today, we're going to talk about the evolution of the renal biopsy evaluation. Those are my disclosures. And the objectives today are to identify some of the techniques and procedures that led to advance of renal pathology, changes on the clinical aspect of kidney diseases that leads us to new interpretations of the renal biopsies, and also the differences on how we evaluate the renal biopsy today compared to just a few decades ago. I like to disclose to you as well that this is not a total eclipse. This is a partial eclipse. It's impossible for me to tell you everything that happened over the past years in renal pathology that has changed everything, the way how we practice today. But I've selected some snippets of things that I thought were interesting and worth sharing. And one of the things that has changed is nomenclature. So let's talk about the evolution of the kidney biopsy evaluation, shall we? When I thought about giving this talk, I thought about, well, where do I start talking about changes on how we interpret? And I decided to put as a starting point 2001. This was my first paper in renal pathology. And it was about transplant glomerulitis at a time that, for you to have an idea, the role of C4D and antibody-mediated rejection is still fully established. So one or two things changed from since then. When I talk to my trainees, usually I say, well, to give a diagnosis of renal pathology, you have to put together some pieces. Those are the clinical history, histology, immunofluorescence, and electron microscopy. Usually the diagnosis of renal pathology is complex, but it's not complicated. It means that we have to put things together like a puzzle, but it's not complicated because it doesn't have many pieces to put together. It seems to be simple. This was then, but since then, multiple things have revolutionized in the way how we change the renal pathology. We have come with a new genetic panels, new immunohistochemistry stains, Waguespack is playing a big role. There are some special stains. New drugs can change the management of patients and can have side effects into the kidney, digital path, and of course, Aristotelic as we are, we have been through different classifications in many, many diseases. So the winds of new knowledge are carrying us to chart new territories, right? And to go over those snippets with you, I would like to get a bus on which compass would I use to show you how things have changed. And my compass is going to be the clinical syndromes here today. I'm going to talk about some changes on the way how we deal with nephrotic syndrome, tubular interstitial diseases, and transplant. Starting with nephrotic syndrome. How about we take membranous nephropathy and evaluate how we give the diagnosis on membranous nephropathy and how it changed over the past years, right? And this is one that I want to tackle quickly before we have new changes over the course of this hour, and I have to update those slides because the diagnosis of membranous nephropathy changed a lot. Of course, to say that someone has membranous nephropathy, we still rely on the same features that we ever did. Thick basement membranes, multiple spikes and holes on silver stains, a diffuse IgG, which is a fine granular along capillary loops, and multiple subepithelial deposits, as illustrated on the electron microscopy. But just some decades ago, we thought about membranous nephropathy as something that we would classify between primary and secondary. It was like we say in St. Louis, it was a chess game, right? Black and white.